Hello everyone, I am Kruti Joshi. We have started a series of Gynic cases, and this is the 21st case, a case presentation on uterine fibroid. The complaints there was a female patient of age 36-year-old who came with the complaints of abdominal swelling since 10 months, no abdominal pain, bowel habit normal, nauseated when ate in large amount, no dysuria or hematuria. Dysuria is the painful urination and hematuria is blood in urine. The medical history: periods are regular every 27 days, have always been heavy with clots and flooding on second and third days, never received any treatment for heavy periods, been with partner for 7 years, and despite not using contraception, she has never been pregnant. Examination: the woman has a very distended abdomen. A smooth, firm mass is palpable, extending from the symphysis pubis to midway between the umbilicus and the xiphisternum, equivalent to 32-week size pregnancy. It is non-tender and mobile. It is not fluctuant, and it is not possible to palpate beneath the mass. No speculum examination. It is not possible to visualize the cervix. The speculum examination is a device which is used to look inside the vagina and observe cervix. Bimanual examination, which is the pelvic examination, reveals a non-tender firm mass occupying the pelvis, and MRI of abdomen and pelvis. Lab investigation: hemoglobin 6.3 gram per deciliter, white cell count 4.9 into 10 raised to 9 per liter, platelets 267 into 10 raised to 9 per liter, mean cell volume 68 femtoliter. Differential diagnosis for intermenstrual bleeding: menorrhagia, which is heavy or prolonged periods; abdominal mass, which is swelling in one part of the abdomen; pressure effect from pressure on the bladder, stomach, or bowel; and infertility. Diagnosis: uterine fibroid. The woman has large uterine fibroid. This is causing menorrhagia and hence the microcytic anemia from iron deficiency. Fibroids are benign tumors of the myometrium which may be extrinsic, as in case. Alternatively, they may be intramural, which is they grow inside the wall, or submucosal, which bulges into the uterine cavity, projecting into the endometrial cavity. Fibroids are not typically painful unless they undergo degeneration, usually in pregnancy. African Caribbean women tend to develop fibroids more commonly than the other ethnic groups. Further investigation: ferritin and folate levels should be checked to confirm the iron deficiency status. It is also advisable to arrange renal function test and renal tract ultrasound, as very large fibroids can cause ureteric obstruction and hydronephrosis, which could need urgent treatment. Here, the ureteric obstruction is a blockage in one or both the tubes of the ureters, and hydronephrosis is the excess fluid in kidney due to the block-up of urine. Uterine fibroids. Now, what are uterine fibroids? Uterine fibroids are the non-cancerous growths in the uterus. They can develop during women's childbearing years. They are made up of muscles and connective tissues from the uterine wall. Now there are three types, as you can see in the image: intramural fibroids, which grows within your uterine wall; the submucosal fibroid, which bulges into the uterine walls; and the subserous fibroids, which grows outside your uterine walls. Now, having fibroid does not increase the chances of getting other form of uterine cancers. Many women aren't even aware that they have been diagnosed with fibroids, as they are very small. uh, if there are larger fibroids, they may have some symptoms such as excessive or painful bleeding during or between the periods, fullness or bloating, frequent urination, pain during intercourse, low back pain, constipation, and inability to urinate. Now, there are many questions like, can fibroids prevent pregnancy? No, it does not prevent pregnancy, but fibroids can grow inside or outside the uterus and in uterine wall. They can be as small as the size of a pebble or as large as the size of a big watermelon. Having them doesn't mean it's impossible to get pregnant. However, they can increase in size during pregnancy. Large fibroids keep a baby from being able to flip into the correct fetal position. They increase the risk of a birth. Now, fibroids can put you at a higher risk of preterm or C section delivery. Now, let's see some of the risk factors of uterine fibroids: higher body weight, having family history of fibroids, not having children, period at a young age, and starting menopause at the later age. The exact cause of uterine fibroids is unknown, and there are various complications which leads to uterine fibroids, such as increasing chance of having a miscarriage, increase in risk of needing a c-section, and more bleeding than a normal with childbirth. There are various treatment for uterine fibroids, such as birth control pills and intrauterine devices. And if you have pain during uterine fibroids, you can give OTC medicine, anti-inflammatory, such as ibuprofen or naproxen. Other than that, there are surgery. There are two, three kinds of surgery. Myomectomy. Now, what is myomectomy? It is the removal of fibroid, but your uterus remains intact. And there is uterine artery embolization, in which the uterine fibroids are removed. And there is an hysterectomy, which is not the first choice for this uterine fibroids. The uterine artery embolization is when your fibroids are shrinked and they are used by the decreasing the blood supply. Now, people with fibroids who do not want to be pregnant can opt for hysterectomy. The other diagnostic exams are pelvic examination, ultrasound, and imaging, where your enlarged or irregular shape of uterus is seen. Now, let's see about the management of uterine fibroids. Here, the woman is having a complaint of anemia, which can be treated with ferrous sulfate. She's having menorrhagia, which can be reduced with tranexamic acid, which is an antifibrinolytic agent. Uh, and gonadotropin releasing hormone analogs are used to shrink the fibroids. Other than that, to remove it surgically, there are processes such as hysterectomy, in which the whole uterus is removed, and myomectomy, in which only the fibroids are removed and not the uterus. Thank you.